Okay, hi. So my name is Bob, and I was about 62 years of age when my wife was taken into hospital with pneumonia. I sat with her for the second day at visiting time, and I felt my neck, and I said, "God, you've only been here 2 days, and my glands are up in my neck. It must be all these sick people in the hospital." Needless to say, obviously she got released from hospital several days later, and I noticed I still had this lump in my neck. So I waited until she was a little bit better, but not too long. That's the key to the way that my treatment transpired, really. I didn't wait too long. I went to see the doctor, my GP, who told me that he said he had a feel in my neck, and he said, "Well, let's give it another couple of weeks and see if it's still there," which, is sort of fairly standard process for having lumps and bumps. They tend to say if it's still there in 2 weeks' time, we'll do something about it. So sure enough, for 2 weeks later, I went back. The GP said, "Right, I'm going to refer you to a consultant at Ormskirk Hospital in West Lancashire." I went to see the consultant, and the conversation went very much like this. He had a look inside my mouth, he had a look at the lump in my neck, and he said, "Right," he said, "I'm not God." He said, "But you've got a cancer in your tonsils. I don't think it's going to kill you, but it needs to come out." So that was sort of almost exactly realised for me the sort of conversation that I was quite happy with, because you know instantly I knew, one, I had a cancer, which I sort of assumed in my mind it might well be, and two, it wasn't life threatening, probably, although we didn't know everything about it at that stage. And that was how the journey started. Yeah, because this lump in my neck, I just, it's not natural, is it? When if you think to yourself, well, where's that come from? And the fact that it wasn't going, the fact that you know what it's like if you have a fever or a virus, that your glands swell up and they go down again, but this wasn't changing, and it was just getting ever so slightly larger. Not rapidly, but I could tell that it was developing, and I just, in the back of my mind, I thought, I'm not expecting good news when I go and have this looked at. And in fact, in some ways, although it wasn't brilliant news, it wasn't as bad as I'd thought it might be when he said, "I don't think it's going to kill you." And my response to him saying that I said, "Look, I've got a big family holiday planned in Australia in 3 weeks' time." And I said, what should I do? And he said, "Well, I don't get involved with people's social arrangements." He said, "But my suggestion would be that needs to come out sooner rather than later. And anyway, would you really enjoy a holiday in Australia knowing that you're going to come back for surgery?" So, it made sense to cancel everything and just get on with it quickly. And everything happened very quickly, very smoothly after that. Yeah, the diagnosis initially was that it was fairly early because it had only spread to one lymph node in my neck. The It was on my tonsils and nowhere else, so that was fairly early. And I was quite lucky in that sense that it required surgery, and then later radiotherapy. In fact, what happened was I had to have two operations. The first operation was probably about 5 hours, 5.5 hours, and that was laser treatment in the tissues in my mouth. I took out my tonsils, cut my neck open here, and took out the lymph node. And then they didn't. The operation was successful, but they didn't quite get as much of the mouth tissue as they would like around the site of the actual tumour. So they had to take me in for a second operation, which was about 2 hours long, about 2 or 3 weeks later. And again, that was successful. On the back of that, I went to see the oncologist, and the oncologist said to me, it's a medium risk tumour, it's not a high risk tumour, so you won't need chemotherapy, but you will need 6 weeks of radiotherapy. And that's worth clarifying, that is 6 weeks, that's every day, every weekday for 6 weeks. And that was at a hospital on the Wirral and Merseyside, which was about an hour and a quarter's journey each way from where I live. So, it's quite a commitment that you have to give to it. And you can't miss a day. You have to go every weekday for 6 weeks. Yeah, the effects and the side effects that you sort of go through they're quite marked. And in the early days, you will get nurses that will say to you in a very reassuring way, "You do realise it can be quite rough for 6 months," and you don't really know what that means at the time, but you can see from the look in their face that they're going to, that they're expecting you to go through a rough time, it's because so much of that part of your body is so sensitive, that laser treatment and radiation treatment is going to cause pain and discomfort. So initially, I mean, you get the first feel of this when you go to the hospital and they fit you for the face mold, which for a lot of people they find that really very difficult. So initially, it's this sort of sheet of hard, I don't know what it's made of. It's almost like cardboardy plastic, really, which they then dampen and they put it over your face, and they spend about good 10 or 15 minutes massaging it into every contour of your face. So it's a mold that is made for your face, not for anybody else. And you afterwards you're free to take it home if you wish, which is something I didn't want to do. But being fitted for the mold is okay, but then when they come to use the mold in earnest, when you're going through the radiation treatment, they fit it to your face, and obviously it's a very snug fit, and then they clamp it just an extra, probably a quarter of an inch, eighth of an inch onto the back plate, which means it fits absolutely snugly and tightly on your face. And some people find that really difficult, and certainly some of the people I talk to, but it's worth being prepared for that, because you're not in the mold for very long. You're only in the mold for about a minute, minute and a half at the most, and then it's off. So you just have to sort of, count to 100 or whatever the case might be, think of cricket or whatever, whatever, something to take your mind off it, and it soon goes. But, some people do find it quite claustrophobic. The other side effects are that when you've had the operation, first of all, there's a few things that happen. So first of all, it's very hard to open your mouth very far. The second thing is you lose most of the saliva in your mouth. The third thing is that your taste buds go. And so all of these things are sort of happening at about the same time as you've had the operation and you're progressing into the radiotherapy. And they all sort of overlap with each other. There is no sort of clear demarcation between the lines as you go through. One doesn't stop and another one starts. So the first thing you notice is that you have very little appetite, and you can't open your mouth and you can't chew very well. So your face gets tired when you're chewing. Your jaw muscles get tired when you're chewing. So therefore, there's no joy in eating, and therefore you have a plate of food put in front of you, and you look at it and think, I don't want it. I can't eat it. What's the point? And that's the first stage of you starting on the sort of quite rapid journey of weight loss. So that kicks in quite rapidly. And all you can do is try and find something that you can eat, and eat it regularly, something full of protein. For instance, in my case, it was soft-boiled eggs. And I was able to eat soft-boiled eggs. I didn't need to open my mouth wide. I could put it in my mouth. I didn't have to chew it very much. It was reasonably full of protein, and that was okay. But a lot of the ordinary things that you might think you could eat, you can't, or you just can't manage to swallow them because your throat is so tight and so sore. The other thing is you also lose texture in your mouth. So if, for instance, one of the things they encourage you to eat are things like rice pudding, because it's full of fat and it's easy to eat, it's creamy, it's got some goodness in it. When the first time I tried to eat rice pudding, it was like I was eating gravel, and it was a very strange sensation. So I just had to spit it out, but I can't eat that. So you have to experiment a little bit with the food that you do eat, because some of the foods that you are recommended to try just won't work, and you just have to go with that and keep trying and keep experimenting. And it might be things that are really unlikely, like, for instance, smoked salmon. I found I could eat smoked salmon, but I couldn't eat fish. I didn't like fish at all. I still don't like fish, but I could eat smoked salmon. So you just have to keep experimenting, and that's something you shouldn't worry about, but you do worry about it because you can't understand why you can't eat the foods that you've traditionally always eaten, and it gets to you a bit, makes you a bit down. The most significant side effects for me over the course of the treatment was initially the pain in your mouth, because you can develop something called mucositis, which is an inflammation of the mucosa inside your mouth, and it's extremely painful. The only way you can best describe it is imagine if somebody lit a match and put it in your mouth. that is the pain that it feels like. It is very, very hard to cope with, and it can last. I think mine lasted probably about 2 months. Usually it's a couple of weeks, but mine took about 2 months to go. So that's the first thing, and that's really painful. And all you can really do for that is take sort of like a morphine-based mouthwash. That's about the only thing that takes the pain away. And of course, while you're going through that pain, you're not eating and you're losing weight. So that's a consequence. The second thing is that you have a very dry mouth, and that's quite common for this type of cancer treatment. For some people, it lasts forever, and quite a lot of people it lasts forever. And you always, have a glass of water handy if you're talking to people, if you're having lunch or dinner or you go out. It socially, you have to make sure that you have covered every base, if you like, that you've always got a drink there just in case some food gets stuck in your throat or you suddenly develop a very dry mouth. So that's something that it feels awkward, and it can be quite distressing if food does get a little bit stuck in your throat. So that's a problem. So the pain, the dry mouth, and probably the third thing was the sort of the sort of long-lasting side effect of losing your taste buds. Not all of your taste buds, but you lose a little bit of that, and that texture side of things in your mouth. You have to sort of start experimenting again with food that you can eat and that you can reasonably enjoy, and then just stop eating the food that you either can't eat or you don't enjoy. So you have to go through that whole process again. And if you were like me and you were someone who used to enjoy food, you do tend to find that you enjoy it a lot less. So it becomes a lot more functional than sociable. And that's a bit of a loss. You think, I used to enjoy my lunches and dinners, but now it's just eating for the sake of eating. And that's sort of a lifelong thing. That's not going to go away. Yeah, and I think one of the things that people often talk about with this sort of thing is how does it affect your quality of life? And I was enrolled as part of a clinical trial at Aintree Hospital, to just fill in a survey every time I go, and the survey does focus quite a lot on the social side and the mental side of how you're feeling. So do you go out for lunch? Do you feel embarrassed when you're eating in front of people and things like that? And those are things that you have to get your head around, and a lot of that comes down to your own personality, in that you have to try and be strong enough and positive enough throughout the whole journey. If you let it get down, and you will have downs, you will have days where you just think this is impossible, but you can get through it. If you're more positive, you can get through it. If you let it get to you, it will get to you. So there is a sort of a mental side of this, that you have to force yourself to be positive even when you don't feel like it. I was lucky in a way in that I have a dog, and within 4 days of the operation, I had to bring the dog out of kennels because it was Christmas. So every day, 3 times a day, I had to take the dog for a walk, and something like that helps you get out. It gets you some fresh air. It gets you some exercise. Exercise is very, very good for getting over this sort of thing, and it helps your head. It helps how you feel about yourself, and it also means you meet up with fellow dog walkers, and they'll say, "What's happened to your neck?" And you tell them, and they either want to talk about it or they don't. The vast majority of people do want to talk about it. Some people find it a bit uncomfortable, and that's fine. You talk about football or something else, but a lot of people are very, very supportive and saying things like, if you're ill, I'll take your dog for a walk. Things like that. So they offer you get offered a lot more support than you were expecting. And obviously you get a lot of family support. My wife was absolutely fantastic. My sons were brilliant. So you get that sort of, support around you that you do need. So don't underestimate the fact that it is really important to have some form of social support, family, friends, dog walkers, whatever it might be. And exercise really is important for how it makes you feel. It's also important, again, and this is the sort of the long term, when you're starting to come out of the sort of doldrums, really, which I had probably about 2 months after I'd finished the radiation treatment. I didn't, I just wasn't eating very much. I'd lost about 10 kilos in weight, that sort of thing. So, quite, and I'm not a big person anyway. So I'd lost about 10 kilos, but then I enrolled on a gym program at our local gym. And I said to the guy, look, I'm probably the only person in here who wants to put weight on. So he said, no problem. He said, we've got lots of strengthening resistance work, which will help you build your muscles up. So I started off, barely lifting any weights whatsoever, and then gradually worked up and worked up and worked up, and set myself a couple of targets. So I had to set myself a target for the end of the program, which is 12 weeks. And then at the end of that, I set myself another target for another 6 months in the gym, which I finished last week, in which I hit the target. And so that's what you need to do. You need to be positive. You need to do something to make yourself better, because you won't necessarily get better on your own. You have to do something about it yourself. My speech wasn't affected as much as I think some other people that I've met have been. But again, I think a lot of it is having, like I have now, a glass of water handy. The thing that's most likely to affect you is the dry mouth. You suddenly find that your saliva's completely gone and you're sort of croaking. And then you start coughing, and of course, unless you can have a drink quickly, you're just going to carry on choking, and it's downward spiral. So I was quite lucky, but you do have to be aware of the fact that somewhere your glass of water, a bottle of water, something close to hand, because it could dry up quite quickly. It was all of it to begin with, because obviously you'd had the operation in your throat, so it was tender. But that sort of healed up a little bit, and got a lot better fairly quickly, probably within about 2 months. Probably that was getting back to normal. It was the sort of mucositis and the heat in your mouth from the radiation treatment that was really painful and lasted a lot longer than people had suggested it might. So that was the greatest problem that I had, was the sore mouth. Yeah, the combination of the mouth pain that you feel is really difficult in the beginning, because you've had the operation, which causes discomfort and pain in itself. You've had a laser surgery in your mouth, and that makes your mouth. So, for instance, the inside of my mouth now is not symmetrical. So I've got an asymmetric mouth on the inside, only slightly. I can't notice it, but the oncologist had a look in there one day and just made that comment. So obviously your mouth shifts; it's a slightly different shape. So in the early days, I was always biting my tongue. So it's things like that. You get over them, but because you're going through those things at probably the worst time in your treatment, it just adds to the frustration and the annoyance and the feeling quite mad about things, feeling very upset about things. You get over it, but it takes a little while, and you need. I remember saying to my sisters at the time, if this cancer comes back, I'm not sure that I'd want to go through this treatment again. Now, in retrospect, having gone through it, and I'm now sort of 18 months from when it was first diagnosed, I probably would go through it again, because I know the story now, I know what it's like. But that's how you feel when you're going through it. You think, this is harder than I thought it was going to be. At the end of my first week of radiotherapy, I was seen by a doctor at Clatterbridge Hospital, and he said, how are you feeling? I said, I'm fine, thank you. He said, you do know it's going to get a lot worse, don't you? And I thought, right, okay, if the doctor's telling me that, and sure enough, at the end of the second week, then the heat starts to build up in your mouth, and that's when you realise that it's going to be sore, and that then doesn't go away. That heat and that just, so it seems to build up and build up and build up as you're going through the radiation treatment, and it lasts for the whole 6 weeks, and in my case, for about another 6 or 8 weeks after that. Looking back on it now, if I had been able to do that, it would have made a difference, because there were times when I thought, God, I don't know if I can do this. And I know, it's a common theme going through this, that no person's journey is ever the same as anybody else's journey. And that's fairly true, but there are some staggering similarities, such as the dry mouth, the pain, the mucositis, things like that are pretty common. And if you're able to talk about those and reassure people about things like that, then there's more chance that they'll get through it more easily. The other thing that comes through this very strongly for me, and which I've been being a bit of an apostle about with my friends and neighbours in the village where I live, is that it is very, very important for men especially, to go to the doctors more often. And we don't do that. We're very bad at it. And I was lucky in that I went to the doctors almost immediately with this and didn't wait. And it only spread to one lymph node, and that was it. If I'd left it a couple of months, it could have been a lot further afield. So if in doubt, go to your GP. That's what they're there for.